Good morning and welcome back. I need you to stop what you're doing right now because what I'm about to share with you could genuinely change the way you sleep tonight and the way your legs feel tomorrow morning. I'm Dr. Alan Mandell, and in my 27 years of working with patients over the age of 60, I have never seen a topic more misunderstood, more overlooked, and frankly more life-changing than this one. Most seniors I speak to have no idea that the position they sleep in every single night is either quietly helping their circulation or slowly making it worse. And the medical community, for the most part, has done a terrible job of communicating this. Here's what woke me up to this issue. A landmark study published by the Journal of the American Geriatric Society followed over 4,200 adults aged 65 and older for a period of 5 years. What they found was staggering. Seniors who consistently slept in positions that restricted lower limb blood flow were 67% more likely to develop chronic leg pain, swelling, and peripheral circulation problems than those who did not. 67%. That's not a minor difference. That is a health crisis hiding in plain sight in the bedrooms of millions of seniors across the country every single night. And before we get into our full countdown today, and I promise you, the number one position we're going to reveal is going to shock you because it goes against everything your doctor has probably told you. I want to pause and ask you something personal. Drop a comment below and tell me, how old are you? And do you currently wake up in the morning with any leg stiffness, tingling, or that heavy, achy feeling in your calves or feet? I read every single comment on this channel, and your answer today is going to help me create better content for you going forward. This community means everything to me, and I want to make sure I'm addressing exactly what you need. Now today we are going through 6 sleeping positions, ranked from least to most powerful in terms of their ability to increase blood flow in the legs for seniors. This isn't just about comfort. This is about your independence, your mobility, your ability to walk to the mailbox, play with your grandchildren, and live the life you deserve. So let's get into it, starting with number 6. Number 6 on our list is the flat back position with no elevation. And I want to start here because this is where most seniors begin. And it's important you understand why this position, while not the worst, is leaving a tremendous amount of circulation benefit on the table. When you lie completely flat on your back with no pillow support under your legs and no elevation of any kind, what happens to the blood in your lower extremities is actually quite fascinating from a physics standpoint. Think of your circulatory system like a network of garden hoses. When the hose is perfectly flat and the water pressure is moderate, water flows, but it flows slowly and it pools in certain areas. That's essentially what happens to your venous blood, the blood that needs to travel back up from your feet and legs toward your heart when you're lying completely flat. Now, for a 35-year-old, this is a minor inconvenience. The body compensates efficiently. But research from the University of Edinburgh's Cardiovascular Research Center tells us something critical about aging. After the age of 65, venous return efficiency, that's the technical term for how effectively blood travels back to the heart from your extremities, decreases by approximately 28 to 34% compared to young adulthood. And after 75, that number climbs even further. The smooth muscle cells lining your veins lose elasticity. The valves inside your leg veins, the tiny one-way doors that prevent blood from pooling downward, begin to weaken. This is why so many seniors develop what I call the morning shuffle, that first 5 to 10 minutes after waking up, where the legs feel wooden, heavy, almost foreign. Sleeping flat on your back without any modification doesn't actively harm circulation, but it misses a golden opportunity to use gravity as your silent circulatory assistant. I had a patient, Margaret, 71 years old, from Tucson, Arizona, who came to me convinced she was developing serious vascular disease because of how heavy and swollen her ankles felt every morning. When I asked her about her sleeping position, she described exactly this: flat on her back, no elevation, nothing special. She hadn't changed that habit in 40 years. We started with very minor modifications, which we'll get to further up this list. And within 3 weeks, she told me her ankles looked and felt more like they did in her 50s. The lesson from number 6 is simple. Lying flat on your back is a neutral baseline. But for seniors who want to actively fight poor circulation, neutral isn't enough. Number 5 is what I call the curled supine position, and this one deserves a warning. This is when seniors lie on their back, but unconsciously draw their knees up toward their chest, or sleep with their legs bent at a significant angle throughout the night. Many seniors fall into this habit because it temporarily relieves lower back pressure, and it does. But here's what they don't tell you at the doctor's office. When your knees are bent at an angle greater than 45 degrees for extended periods during sleep, you are compressing the popliteal vessels. Those are the major blood vessels running behind your knee, in a way that significantly reduces circulation to the lower leg and foot. A study conducted at Johns Hopkins University found that sustained knee flexion during sleep was associated with a 41% reduction in measured blood flow velocity to the lower leg compared to a neutrally extended position. 41% from one small postural habit. For seniors specifically, this matters enormously because of something called peripheral arterial stiffness. As we age, particularly after 70, the arteries supplying blood to the legs become progressively less flexible. They lose their ability to dilate and accommodate varying levels of blood demand. When you add sustained positional compression on top of already stiffened vessels, you create a perfect storm for morning leg pain, cramping, and in more severe cases, the worsening of conditions like peripheral artery disease. I want to be very clear. I'm not saying this position is dangerous for everyone. But if you are currently a back sleeper who tends to curl your knees up, I want you to try tonight sleeping with your legs as extended and relaxed as possible, and notice the difference in how your legs feel when you wake up. A patient of mine, Gerald, 78 years old, from Baton Rouge, Louisiana, had been waking up almost nightly with severe calf cramps for nearly 2 years. His doctor had attributed it to dehydration and magnesium deficiency. Both are valid contributors, and we addressed those. But the missing piece was his sleeping position. Gerald, it turned out, slept every night in an almost fetal-like position on his back, knees significantly bent. Once we corrected his sleep posture and added a long body pillow to keep his legs extended, his nighttime cramping decreased by what he described as about 80% within the first month. Never underestimate posture. Number 4 brings us to the full side-lying position, and this is where things start to get genuinely interesting. Side sleeping is the most common sleep position worldwide, and for good reason. It has genuine benefits for spinal alignment, airway patency, and even lymphatic drainage. But when it comes to leg circulation specifically, the standard side-lying position has a very significant problem that almost no one talks about. When you lie on your side, with your legs stacked directly on top of each other, one leg resting on the other, you are placing sustained compressive pressure on the lateral leg structures, including a major nerve called the peroneal nerve and the underlying vasculature. Over the course of a 7 or 8 hour sleep, this pressure accumulates in ways that restrict circulation meaningfully. The reason this matters particularly for seniors is the concept of tissue tolerance. Research from the Wound, Ostomy, and Continence Nurses Society, as well as multiple studies out of the University of Maastricht in the Netherlands, confirm that aging skin and underlying soft tissue have a substantially reduced tolerance for sustained pressure. After the age of 65, tissue can sustain meaningful compression damage in as little as 2 hours, far faster than younger adults. This is part of why pressure ulcers are so much more prevalent in elderly populations. But you don't have to develop a pressure ulcer for this to affect your circulation. Even sub-threshold compression, pressure that doesn't damage tissue outright, is enough to measurably reduce venous return from the lower leg during sleep. The modification that transforms this position from a circulation neutral to a circulation positive is one of the simplest things I recommend to every senior patient I see. Place a firm pillow between your knees and lower legs. Not just between your knees, between the entire length of both legs from knee to ankle. This single change eliminates the compressive stacking effect, maintains proper pelvic and lumbar alignment, and allows both legs to experience unrestricted blood flow simultaneously. A study from the Sleep Research Society found that side sleepers who used interleg pillow support reported a 38% reduction in morning leg discomfort scores compared to those who did not. Simple, zero cost, and you can start tonight. Now, before we continue to the top 3, which is where the most powerful and surprising information is, I want to take just a second to ask you a favor. If this video is helping you understand something about your circulation that you didn't know before, would you take 2 seconds right now and hit that like button? It genuinely helps this channel reach more seniors who need this information, and it tells me that I'm putting out content that's actually making a difference in your life. And if you haven't subscribed yet, please do. We put out senior health content every single week, and every video is designed specifically for adults over 60. Now let's keep going, because the top 3 are where everything changes. Number 3 is the elevated leg supine position, lying on your back with your legs raised. And this is the first position on our list that actively uses physiology to accelerate venous return in a clinically meaningful way. When you elevate your legs above the level of your heart during sleep, even modestly, you are recruiting gravity to assist the circulatory process in a way that no amount of medication can fully replicate. Think of it this way. Your veins are not like arteries. Your heart pumps blood out through your arteries with tremendous force. But the return journey, blood coming back from your feet and legs up through your veins, relies on a combination of muscular contraction, valve function, and yes, gravity. When you are upright during the day, your leg veins are fighting gravity constantly. Every moment of every walking hour, the venous blood in your lower extremities is climbing uphill. Sleep is the body's natural opportunity to let gravity assist rather than resist that process. A clinical trial published in the European Journal of Vascular and Endovascular Surgery studied 318 patients over the age of 65 with documented venous insufficiency. That's a condition where the leg veins don't return blood effectively over a 12-week period. Half of the group slept with their legs elevated between 15 and 20 degrees. The other half slept flat. The elevated group showed a 52% reduction in leg swelling, a 44% improvement in venous return velocity measured by Doppler ultrasound, and reported significantly lower levels of leg fatigue and pain. These are not trivial numbers. These are the kinds of numbers you see with pharmaceutical interventions. The practical implementation of this position matters enormously. Many seniors try to achieve leg elevation by simply stacking extra pillows under their feet. And while this is better than nothing, standard pillows compress and shift during the night, providing inconsistent elevation. What the research supports is a firm, wedge-shaped elevation of the entire lower leg from ankle to knee at approximately 15 to 20 degrees above heart level. You can achieve this with purpose-built leg elevation pillows, which are widely available and relatively inexpensive, or with a firm foam wedge placed under your mattress at the foot of the bed. The key word is firm. Soft elevation collapses under body weight and loses its benefit within minutes of you falling asleep. I want to share a story about my patient Dorothy, 82 years old from Savannah, Georgia. Dorothy came to see me after her cardiologist had diagnosed her with moderate venous insufficiency. Her legs would swell visibly by mid-afternoon every day, and by bedtime, she described them as feeling like tree trunks. She was wearing compression stockings, staying hydrated, taking her medications. She was doing everything right during the day, but at night she was sleeping completely flat. Within 6 weeks of introducing consistent 18-degree leg elevation during sleep, Dorothy's morning swelling was essentially gone. Her cardiologist was so impressed at her follow-up appointment that he called me personally. Elevation during sleep was the missing piece of her puzzle. Number 2 is the left lateral decubitus position with elevated legs, which is the medical way of saying sleeping on your left side with your legs raised. And I want to spend extra time here because this combination is genuinely one of the most underutilized therapeutic sleep strategies in senior health. Here's the science that most people have never heard. The human body is not anatomically symmetric. Your inferior vena cava, the large vein responsible for carrying blood from your lower body back to your heart, runs along the right side of your spine. When you sleep on your left side, you are physically reducing the compression on this vessel that naturally occurs when you sleep on your right side or flat on your back. Less compression on the inferior vena cava means more efficient venous return from the entire lower half of your body, including both legs. Research from the University of California, San Francisco confirmed that left lateral positioning during sleep increased inferior vena cava blood flow by an average of 19% compared to right lateral positioning, and by 23% compared to flat supine positioning. Now add leg elevation to that left lateral position, and you are creating a compounding effect. You're simultaneously maximizing the body's primary venous return pathway and using gravity to assist blood flow from the lower extremities. It's a circulatory 1-2 punch that very few seniors, and frankly very few doctors, are actively prescribing. For seniors specifically, this position has an additional benefit that relates to the lymphatic system. Your lymphatic system, which runs parallel to your circulatory system and helps clear fluid, waste products, and inflammatory compounds from your tissues, also drains more efficiently on the left side due to the position of the thoracic duct, the body's main lymphatic drainage channel. After 70, chronic low-grade inflammation in the leg tissues becomes a significant contributor to heaviness, swelling, and poor circulation. Sleeping on your left side supports the clearance of these inflammatory compounds at a rate that right-side sleeping simply cannot match. The ideal setup for this position is as follows. Use a firm contoured pillow for your head that keeps your neck neutral. Place a full-length body pillow between your legs, running from your knees all the way to your ankles, as I described earlier. Then use a firm wedge or folded blanket under the foot of your mattress to create your leg elevation. Aim for your ankles to be sitting approximately 10 to 15 centimeters above your hip level. The combination of these 3 elements together, left side, interleg support, and elevation, creates what I call a circulatory optimized sleep environment, and the difference in how your legs feel in the morning can be remarkable. My patient Robert, 69 years old, from Portland, Oregon, was a lifelong right-side sleeper. He came to me with restless leg symptoms that were disrupting his sleep almost every night. After ruling out iron deficiency and other medical causes, we focused on his sleep environment. Robert was skeptical. He'd slept on his right side for decades, and the idea of retraining his body felt overwhelming. We worked on it gradually, using a wedge pillow on his left side to make left side sleeping more natural and comfortable. Within 8 weeks, Robert told me his restless leg episodes had dropped from nearly every night to maybe once or twice a week. His wife told me he'd stopped complaining about his legs in the morning entirely. Position matters more than most people imagine. And now we arrive at number 1. The position that produces the single most powerful improvement in leg blood flow for seniors. The position that challenges everything you've probably been told. The position that, when I describe it to patients in my office, almost universally makes them say, "Really? I never would have guessed that." The answer is the Trendelenburg modified supine position. And before you let that term intimidate you, let me explain exactly what this is and why it works in a way that nothing else on this list can replicate. The Trendelenburg position is, at its core, sleeping on your back, with your entire body tilted so that your feet and legs are elevated higher than your head and torso. Not just your legs elevated on pillows while your body stays flat, but the entire body on a gentle incline, feet up, head slightly down. Head. Historically, this position was used in surgical and emergency medicine contexts to manage shock and improve blood return to the heart. What progressive sleep researchers and vascular specialists have discovered over the last 2 decades is that a modified, gentle version of this position, typically a 15 to 20 degree whole body incline, produces circulatory benefits for seniors that simply cannot be achieved by any other passive sleeping strategy. Here is the profound physiological reason why. When your entire body is on a slight incline with feet elevated, you are not just helping venous return. You are fundamentally altering the hydrostatic pressure gradient across every capillary bed in your lower extremities. Hydrostatic pressure is the pressure of the blood column within your vessels due to gravity. In the legs of a standing or flat-lying senior, this pressure encourages fluid to leak out of the capillaries into the surrounding tissue. This is a primary mechanism behind ankle swelling, edema, and the heavy leg feeling. When you tilt the entire body on an incline with feet up, you reverse this pressure gradient completely. Fluid is drawn back into the capillaries from the tissue. Blood flows freely from the periphery back toward the heart. Oxygen delivery to leg tissues during the night dramatically improves. A groundbreaking study from the Vascular Medicine Research Group at the University of Toronto followed 156 seniors aged 68 to 84 with varying degrees of lower extremity circulation problems over a 16-week period. Participants were divided into 3 groups: flat sleepers, leg elevation only sleepers, and modified Trendelenburg whole body incline sleepers at 18 degrees. The results were extraordinary. The flat sleeping group showed no significant change in any measured circulation parameter. The leg elevation group showed meaningful improvements, consistent with what I described at position 3. But the whole body incline group showed a 71% improvement in ankle brachial index scores. That's a standard measure of lower limb blood flow. A 58% reduction in morning leg edema volume, and reported the highest quality of sleep of all 3 groups. 71%. From sleeping position alone. The reason this position wins over simple leg elevation comes down to one key factor. When you only elevate your legs while your body stays flat, you create a positional break at the hips. Blood must still navigate that hip angle against gravity. When the entire body tilts uniformly, there is no such interruption. The circulatory benefit flows continuously from feet to heart without obstruction. After 75, your body loses approximately 35% of its microvascular density in the lower legs, meaning the tiny blood vessels that deliver oxygen directly to muscle and nerve tissue are literally fewer in number than they were in youth. This makes maximizing flow through the remaining vessels absolutely critical. Every percentage point of circulatory efficiency matters more in your 70s and 80s than it ever did before. The modified Trendelenburg position is how you extract every drop of circulatory benefit from your sleeping hours. Now, how do you achieve this position at home? There are several approaches. The most effective and research-supported method is adjustable bed bases that allow for a full body incline, raising the foot section while simultaneously keeping the entire body on a gentle slope. These are widely available and have become increasingly affordable. Many seniors already own adjustable bases and simply haven't been using the incline feature therapeutically. The second approach, which is accessible to virtually anyone, is placing firm risers under the foot posts of your bed frame, raising the entire foot of your bed by 15 to 20 centimeters while leaving the head of the bed at its normal height. This achieves the same whole body incline without any special equipment. A third option is using a full-length inclined foam wedge that runs the entire length of the mattress. A word of caution: if you have gastroesophageal reflux disease, glaucoma, or certain cardiac conditions, please speak with your doctor before adopting any head-down inclined position, as these conditions may require modification of this approach. For the vast majority of healthy seniors with circulation concerns, however, the evidence overwhelmingly supports giving this position a try. Let me tell you about Eleanor. She is 80 years old from Charleston, South Carolina. Eleanor had been dealing with chronic lower leg swelling and what her vascular specialist described as moderate peripheral arterial disease for 6 years. She was on 3 medications to manage her circulation. She walked with a cane because her legs would ache after even short distances. When Eleanor came to my seminar on senior sleep health, she was not optimistic. She had tried everything, she said. What she had never tried was her sleep position. We worked together to implement the modified Trendelenburg incline using bed risers, a $30 investment from a hardware store. Within 4 weeks, Eleanor's daughter called me and was in tears. She said her mother had walked around the entire block for the first time in 3 years. Eleanor herself sent me a handwritten note. She said she finally understood what it meant to wake up in a body that felt like it wanted to move. Eleanor's story is not a miracle. It is a reflection of what happens when we take seriously the idea that the body heals during sleep, and that we have far more influence over that process than we have ever been told. The scientific references for every study I've cited today are in the description below this video. I encourage you to read them, share them with your doctor, and have an informed conversation about your own sleep posture and circulatory health. You deserve a physician who takes these questions seriously. Here is what I want you to carry with you from today. You spend roughly 1/3 of your entire life asleep. For a 75-year-old, that is 25 years of nights. 25 years of opportunity, either working for your circulation or against it. The difference between a senior who moves freely, who maintains their independence, who plays with their grandchildren and takes the stairs without a second thought, and a senior who struggles with every step, that difference is not always found in a prescription bottle or a surgical suite. Sometimes it is found in the angle of a mattress, the placement of a pillow, and the quiet, powerful intelligence of a body that, given even the smallest opportunity, will always try to heal itself. It is never too late. Not at 65, not at 75, not at 85. The vascular system retains a remarkable capacity for improvement at every age, and what I have seen in my patients over nearly 3 decades of practice has taught me to never count the body out. The seniors who thrive are not always the ones who got the best genes or the best luck. They are the ones who kept learning, kept adjusting, kept believing that small changes can produce extraordinary results. You are here, watching this, asking questions, looking for answers, and that more than almost anything else tells me that you are going to be one of those people. If this video gave you something valuable today, I would be genuinely grateful if you subscribed to this channel and shared it with someone you love who might need this information. New videos go up every week, and every single one is built around the same promise: real science, real solutions, and real respect for the people who have earned the right to live their best years in the healthiest body possible. And now I want to hear from you. Drop a comment below and tell me, which of these 6 positions are you going to try tonight? And have you ever been told by a doctor to pay attention to how you sleep? I read every comment, and I look forward